Congratulations on being a member of the staff of the MGH Special Pathogens Unit. This presentation is one part of the training you will receive to learn how to safely care for a patient on strict isolation. This short presentation will focus on the correct use of the personal protective equipment, also referred to as PPE, that must be worn when entering the room of or caring for a patient who is on strict isolation. Strict isolation is a combination of two other types of isolation precautions that you are already familiar with. They are contact isolation and airborne isolation. What makes strict isolation different is that eye protection in the form of goggles or a face shield is also required to protect your eyes from exposure to droplets or aerosols from the patient and also to prevent you from touching your eyes inadvertently. In addition, there is a specific sequence for removing your PPE to reduce risk of self-contamination. Let's review some key points about the use of PPE. First, why do we wear it? PPE is worn primarily to prevent contamination of hands, skin, and clothing, and to protect us from breathing in organisms that cause infections that are spread through the air like TB or measles. Why do we want to prevent contamination, hands, skin, and clothing? Well, the purpose is twofold. First, preventing contaminations reduces the risk that healthcare workers will carry pathogens from patient to patient, thus potentially spreading infection. The second reason is to prevent healthcare workers from exposure to blood-borne pathogens such as HIV or other infections they may be susceptible to. Since these are both important aims, it is important to understand that PPE is only effective at preventing contamination if it is put on, also known as donning, and removed, also known as doffing, correctly. Correct use of PPE includes donning PPE fully before room entry and before contact with the patient or contaminated surfaces, and doffing PPE either at the doorway or immediately outside patient room just before exiting. The exception to this is respiratory protection such as an N95 respirator. This must be removed after exiting the patient's isolation room. More about this later. Your behaviors while wearing PPE is also important if PPE is to be effective. When gloves are worn, you should not touch your face or your eyes as your gloves are potentially contaminated with pathogens. You should also not reach under your gown to retrieve a phone or pager as you will contaminate both your clothes and the device.